Hey guys, I'm Harley, and I'm going to be telling you about my absolute favorite place to go here in Central Georgia. I'm from a small town called Sandersville. We live about 30 minutes away from another small town called Milledgeville. Now, if you're from Georgia, or if you know anything about Georgia history, you know that Milledgeville was our first capital back in the 1800s. They had thriving businesses and rich cotton fields everywhere, which brought in a population increase. And with this population increase came a lot of people who were suffering from problems and diseases that not many people knew anything about. So in 1837, Georgia lawmakers passed a law to open up a lunatic, idiot, and epileptic asylum in Milledgeville. This is where they were going to house all these people who suffered from these problems, such as epilepsy, idiocy, and anyone who they considered a lunatic. A century after it opened, over 200 buildings were constructed on 2,000 acres worth of land. They housed up to 13,000 patients and counting. It was then called Central State. The institution was so large that it was considered the largest asylum in the world at that time. People from all over were being sent to Central State Hospital to get treated. They treated everything from epilepsy, schizophrenia, paranoia, and many other diseases. They even treated some things that weren't really considered a sickness, but they did not know. Such as they would put men in there for masturbation, because it was a sin. They would put women in there for menstruation and menopause because of the way they were acting. And they also treated spirits, which is now known as alcoholism in today's world. The patients were treated and mistreated a lot at the hospital. With as many experiments going on back in the 1800s, Central State was one of the main hubs for lobotomies, electroshock therapy, straitjackets. They confined children in cages. They would chain patients to the floor. They made them take steam baths, cold showers, and they also built houses with no windows, and they would chain them in there as well and leave them. If it was an experiment, it was probably happening at Central State. By the 1950s, the doctor-to-patient ratio was 1 to 100. They outgrew their resources, and the conditions of Central State were very grim. It was an unsanitary place, and most people who died within the early years of being at the hospital died of dysentery, which is diarrhea. This comes from unsanitary conditions and bad plumbing. In the 1960s, Jack Nelson of the Atlanta Constitution launched an investigation on Central State. He stumbled across the unsanitary conditions, the treatment of the patients, and he realized how low the doctor-to-patient ratio was. He even realized that they were making some patients help run the hospital. They were making women be nurses and sometimes even be doctors themselves. A law was then passed in the mid-60s on a new psychiatric drug that would help the mental. This would help the people move to a less restrictive area, and by this time Central State's numbers began to drop. By the late 70s, almost all of Central State was vacated. And in 2010, a law passed to put a stop to Central State completely. And after this law passed, Central State was no longer allowed to accept any new patients, and all the patients that existed were moved out. Today, all the buildings are vacated, except for 4. There are only 200 people remaining on the campus. One of the buildings is a prison, where the 200 people are criminals who are housed there, and one is a VA, and the other 2 are just Central State offices. There is a redevelopment authority who is planning on tearing down the buildings to make way for new economy. There is a museum present on the grounds of Central State, and it houses all the relics from the past of Central State. Thank you.